something hard and unbending. Very few of us consider that our bones are living, breathing tissues made up of cells, fibers, vessels, and nerves, and that they are resilient and alive. Our skeleton has several functions. It protects our vital organs, gives us shape, and allows us to move, as well as stores calcium and phosphorus, produces red blood cells, and acts as anchors for muscles. At birth, we have approximately 350 bones. By adulthood, we only have 206 bones because as we grow, some of our bones join together to form one bone. The skeleton is divided into two parts, the axial skeleton and the appendicular skeleton. The axial division is composed of 80 bones that form the axis or principal structure of the body. It includes the skull, vertebral column, rib cage, and hyoid bone. We like to think of this as the fish skeleton. The axial system is the first system on the evolutionary scale and is based on many short bones that have small movements with muscles that cross many joints. This leads to a great amount of stability and strength. The appendicular skeletal system includes the 126 bones of the arms and legs, hence the word appendicular or appendage. On an evolutionary scale, the system evolved later and is based on a few long bones with muscles that cross only one joint. The appendicular system is better for walking on land and swinging from trees. The axial system is better for swimming. Bones change throughout our lifetime. In the fetus, they exist as cartilage, then a process of hardening called ossification begins and progresses through the early stages of life, until the bone reaches the final shape and size according to its genetic code, usually by the age of 25. When bones are stressed, they create more bone. Just as muscles respond to weight training by creating more muscle mass, bones too will create more mass to accommodate stress. A dowager's hump, for example, is actually increased mass in the cervical and thoracic vertebrae formed to accommodate the strain of chronically slumped posture. Conversely, when there is no stress at all, as in paralysis, it causes the bones as well as the muscles to atrophy. This is how archaeologists can tell from ancient bones if a person performed manual labor. Bones are composed of cells, blood vessels, marrow, and connective tissue. Three types of bone cells are osteoblasts, the bone builders, which create new bone tissue and give bone its strength; osteocytes, which help to maintain bone as living tissue; and osteoclasts, the bone clearers, which are very large cells formed in the marrow that absorb and remove unwanted tissue. Blood vessels run through microscopic channels within the bone called haversian canals. The marrow is the soft vascular tissue filling the interior cavities of the bone and is the major site of red blood cell production. Three types of bone tissue are compact or dense, that is hard and forms the protective shell around all bones; spongy or cancellous, meaning having an open, latticed, porous structure, which is found inside almost all bone; and subchondral, which is the smooth tissue found at the end of a bone that is covered with cartilage. Surrounding each bone is a layer of thin connective tissue called the periosteum and serves as a protective covering and as an attachment point for muscles, tendons, and ligaments. Bones are classified by shape: flat, long, short, and irregular. Flat bones are thin, flattened, and usually curved, such as those found in the skull and the scapula. They are sandwiches of spongy bone between two layers of compact bone. Some of the flat bones in the skull or cranium are the frontal bone, which forms part of the cranial cavity as well as the forehead, the brow ridges, and the nasal cavity; the left and right parietal bones, which form the superior upper and lateral or the side part of the cranium; the left and right zygomatic bones or cheekbones that are located on the sides of the head next to the eye sockets, the sphenoid bone, which forms part of the eye orbit and lies between the temporal bone and the frontal bone. The occipital bone forms the posterior or back and lateral portions of the skull and has a bottom lip called the occipital ridge. Many neck muscles attach here. The left and right maxilla or upper jaw bone house the upper teeth and form part of the nose, eye orbit, and roof of the mouth. The mandible or lower jaw bone houses the lower teeth and articulates with the temporal bones at the temporal mandibular joint. And finally, the free-floating hyoid bone, which supports the tongue and part of the larynx. Long bones, such as those of the arms and legs, have a strong shaft with a central, hollow, tubular region made of compact tissue and have a slight bend to absorb shock. They are referred to as long because they are greater in length than they are in width. Their cavity is filled with bone marrow, and the shaft walls consist of compact, hard bone. The main long bone of the upper arm is called the humerus. There are two bones in the lower arm. With the palm facing forward, the radius is on the lateral side, and the ulna, the stationary axis, is on the medial side. The long bone in the upper leg is called the femur and is the longest, largest, and strongest bone in the body. The tibia, or shin bone, is the larger of the two bones in the lower leg. The fibula is parallel to the outside of the tibia. The tibia and the fibula extend from the knee to the ankle and articulate with the femur and the bones of the ankle. Other long bones in the feet are the metatarsals, meta meaning after or behind, and the phalanges or toes. The other bones in the feet are considered short bones and are called the tarsals. We will see the same configuration of bones in the wrist. The carpals are a group of short bones here, then the longer metacarpals, and again the phalanges, which are the fingers. The irregular bones are all the bones which don't fit into these arbitrary categories, such as those in the vertebral column. The bones in the vertebral column are divided into 5 categories. At the top are the 7 cervical vertebrae. The cervical vertebrae can move in all directions. Next are the 12 thoracic vertebrae, which are joined to the 24 ribs. The thoracic vertebrae mainly rotate. Below the thoracic vertebrae are the 5 lumbar vertebrae, which support most of the body's weight. The lumbar vertebrae mainly flex, extend, and side bend, and are limited in their rotation. This means that when a client has trouble flexing forward or side bending, look to the lumbars. If they experience discomfort on rotation, look to the thoracic vertebrae. At the base of the lumbar vertebrae is the triangular-shaped bone called the sacrum, and beneath the sacrum is the coccyx, or tailbone. The connection between the sacrum and the hips is where a lot of lower back pain occurs. Remember that the vertebrae, ribs, and cranium make up the axial skeleton, and the arms and legs make up the appendicular skeleton. Connecting the legs to the torso is the pelvis, made up of 3 bones, the ilium, ischium, and pubic bone. Connecting the arm to the torso is the flat scapula and the clavicle. Now that you have a better understanding of the skeletal system, it's time to move on to disorders and diseases that affect the bones and how massage can help to support and heal those conditions. Fractures are defined as any break or crack in the